Okay, I think we're going to make a start now. Welcome again to this webinar. For those who don't know who I am, my name is Dippin. I'm the Head of Professional Services here at PharmaPlus, and this is a webinar we tend to do every month or so. We've done quite a few sessions. The one that we did last month was on danger symptoms. The session before that was on questioning techniques, and these are sort of things we tend to go over each month. This month, what we're going to do is, because summer's coming up, well, it doesn't really look very much like summer, but believe it or not, it is coming up. I thought it would be a good idea just to quickly go over a few brief things about summer medicine. And what I didn't want this to happen, what I didn't want to happen this month was what was just to focus on the common things like hay fever and all these things. I mean, I'll include a little bit in there. But I was thinking, well, what other sorts of things in summer that you might come across or so forth, and there's a few things that you may want to be aware about. So today is not just simply about hay fever. I really didn't want to make it like that. Today is very much about some of the additional things that you, as counter assistants, are likely to encounter in the pharmacy. So the usual format, for those of you who don't know, is I tend to do these in a mind mapping format. The reason is that it allows us to sort of condense a lot of information in a very small space, and I hate the use of PowerPoints, etc. Just a few ground rules, really. If you do want to ask any questions, by all means, do so. What I would suggest is a text box on your computer somewhere. It's normally located to the left-hand side. Write or type in a question if you want to, and what we'll do at the end, I'll unmute everybody, and you can have your say, or you can ask questions verbally if you want to as well. But at least that way, if I'm going too fast or if I'm going too slow, or if you want to ask an urgent question, it will allow the flow of the webinar to continue. So at the moment, if you need anything, just text me, pardon me, and we'll make a start. Now, this sort of webinar got me thinking about some of the things that I've come across in the past, and there's quite a few things really. As I said, I didn't want to concentrate just on hay fever, although I have put a little bit in there. But what I want to do is look at some of the things that you're likely as pharmacists and as counter assistants to come across in the summer, and really give you an overview of it. So you can see here, there's eight things here which that I've seemed to sort of like come across as a general theme for summer, and some of them are quite unusual. You probably haven't really thought about it too much, but some of them are quite obvious, things like bites and hay fever, etc. So what my intention is, I'm going to go over it in a sort of like anti-clockwise order. So we'll go into clockwise order even. We'll go into barbecue. Now, this is when I was researching this, it seemed really bizarre for me to put this on, but I just thought that, you know what, this is actually quite true. I felt that it was something that I really wanted to sort of share with you. Now, summer, as you probably gather, is a nice time of year. You know, people have barbecues, they cook food outside, and this is something that I've come across on quite a few occasions. In actual fact, people come in with cases of food poisoning, basically because they haven't cooked the food properly. It seems daft, but it is actually very true. In actual fact, the research seems to suggest that the cases of food poisoning double over the summer, and that actually because of undercooked food or incorrectly cooked food on the barbecue itself, especially meat. Now, what I intend to do is go into this in too much detail. This is not a seminar or a lecture or a webinar about how to cook food. It's really about, well, if somebody comes to the pharmacy and they're suffering from food poisoning, what do you give them? And there are quite a few things. You know, you can give them something like Imodium or loperamide. That will help with the diarrhea. That can be supplemented if necessary with Diarrolite, which will help with any dehydration. Although in most cases, water will tend to suffice. And the usual sort of things. So you've got things like paracetamol for any fever that you got. If you're feeling a bit nauseous, you've got Pepto-Bismol as well. And this is actually a good time to remind them as well about hand washing as well. So you've got the alcohol type gels needed, but better still, using soap and water is actually much better as well. But some of this, you know, the alcohol swabs or the wipes can be quite a good way of link selling there as well. So if you think about it, food poisoning as well, you can get quite a few things around that you can actually sell. You can sell one or all of these if needed, as well as some sort of hand washing facility, things like alcohol swabs, etc. So it's quite amazing to see that actually it doubles over summer, which is quite unusual. The other thing you've got to bear in mind as well is burns. Now, obviously, the barbecues are very hot little creatures. They can cause quite serious burns if used inappropriately. The coals, especially the heat generated from there as well. So, the sort of things you may want to be aware of is the difference between major and minor burns. And really, if it's a major burn, if it's a larger area of the skin, or reasonably large area of the skin, more than a 10p piece or so, actually even a 5p piece might be even bad enough, but about 10p or so, then you probably want to get that dressed up in the hospital. You won't want to sort of take them straight away down there. If it's a minor burn, you can give other things like, for example, Burnies. That's quite good if it's a very small burn. It's just more of an irritation rather than anything which is too painful, and possibly a dressing of some sort just to cover up. Bear in mind the fact that if it is a major burn, that you'd want to sort of like refer them over to hospital. And really, with barbecues and with hot coals and etc., I mean, it's not your job again, but just to bear in mind the fire safety element there. There's not much you can sell in the pharmacy for that. But these two sort of go hand in hand. So the two sort of things you're most likely to come across in summer, especially with this sort of thing in mind, is, as I said, the food poisoning element, and that's actually especially people vulnerable to that, especially the elderly and children, and also the fact that you could actually get burns, and the difference of what major and minor burns are and what you do in each instance there as well. So, very unusual thing to start off with. It's not the sort of thing that I intended to start off with, but when I did look into this, it was quite a nice thing to put on to begin with. Now, vitamin D is something that, let me just open all these up, that is quite important, especially in the summer months as well as the winter months, in actual fact. Pardon me. Just a look, again, it's not going to be a lecture about vitamin D. I'm just going to very briefly go over this. Vitamin D is actually synthesized by the body. It can also be taken by the diet as well. There's a number of different foods out there which are rich in vitamin D. The problem is that in the UK, there's little sunlight, especially in the winter months, and even in summer, it's quite limited as well. And also, diet itself is not very rich in vitamin D. If you go, for example, to a GP practice, I've done many audits at GP practice in vitamin D. There are a huge number of people out there who are deficient in this particular vitamin. Now, the reason why vitamin D is so important is actually needed for bone density, for bone growth, and also there's been some recent evidence as well to suggest that it can actually create some neurological issues as well. Alzheimer's, I think, is one thing that was mentioned in it as well. So it has actually got a very important function in the body. The problem is that in the winter months, because vitamin D is synthesized by the reaction of sunlight on your body, it tends to decrease in production. And there are a number of different people who are very much at risk from vitamin D deficiency. For example, you've got things like pregnant and breastfeeding women, babies, under 2 years old, I shouldn't say baby, but under 2 years old, under 65, the housebound, especially because they don't get out very much as it is. I mean, the last thing you want is to be in winter and housebound as well. And also, people with darker skins, their skins tend to produce less vitamin D, especially in this sort of sunlight. In the winter months, your vitamin D production decreases. The reason why in summer it's actually quite important to go out in the sun, not for too long, but it is important to go out in the sun. And ideal time, sorry, let's take that off. The ideal time is between about 11 a.m. to 3 p.m. That's when the sun intensity is at its most. But no more than about 10 to 15 minutes, otherwise you could actually end up getting burnt. Now what tends to happen is that the stores of vitamin D tend to increase in summer, and then they're used in the winter months. But if, for example, you don't get enough vitamin D with the sun, then you will need to supplement it through dietary requirements. So hence where vitamin supplements may come in handy. You may even need to, for example, refer that patient back to the GP to get an assessment as to what the vitamin D levels are like, and it might need a very short, sharp burst of very low amounts of vitamin D just to get that level back to normal again. So again, a very important thing with that, sunlight as well. I'm going to come to burning and heat exhaustion and sun safety in a minute. So this sort of like tends to go hand in hand with that. So just a little sort of like mention on vitamin D. Now the sort of things again, now again, it doesn't seem to look very much at the moment that we're going to get a heat wave. In actual fact, it's probably the exact opposite. These are sorts of things that are quite important in actual fact, because people die from it, and you may want to recognise the signs of somebody who's suffering from heat exhaustion or heat stroke as well. Generally, a heat wave tends to be created, or an alert for a heat wave tends to be created where there's where this sort of, it's a rule of thumb, it's not exactly a rule, but it's sort of like a general indication whereby the temperature during the day exceeds, or is around about 30 degrees, and at night is about 15 degrees Celsius for about 2 days or so. There are several levels of heat wave. There's 1 to 4, where 4 is extremely severe. And the issues that you may want to watch out for is anybody coming in for things like dehydration, heat exhaustion, heat stroke, and especially watch out for people who suffer from these things. If they're young, if they've got breathing problems, they've got heart conditions, or stroke patients in particular. And the sort of things you might want to look out for are things like nausea, vomiting, tiredness, general sort of like malaise. The sorts of things that I'm sure every one of you probably have experienced when you've been out in the sun for too long. Headaches is another particular one. If you suspect anybody suffering from this, it's probably something you need to call the ambulance, or if it's a really, really serious thing. Or if it's too serious, get them indoors and get them to rest as well, and drink lots of water too as well. So it's a little bit about heat wave as well. Again, it doesn't look very much as if we're going to be getting very much this summer, but something for you to bear in mind. Now, where the sort of traditional sort of things in a seminar like this will tend to come out, hay fever, and I do not intend to go into this in any detail. You can find a lot of these things on the internet and various sessions that we've done in the past. Pardon me. But I'm going to briefly go into it, because you can't have any summer medicine type of webinar without going into this anyway. So, in terms of hay fever, about 20% of the population is affected in some form or another. And that's caused by a variety of different things, mainly pollen, and that's released at different times throughout the year. You've got grass pollen, you've got tree pollen, and so forth. Now, medication, I'm sure you know about the symptoms. You tend to get very sneezy, you tend to get irritated nasal passages, you tend to get streaming nose, and all these sort of things tend to happen. There are several medications that you can take. Again, I'm not going to go into too much detail on this. You can find out for yourself. There's a pardon me, sorry, I've got a very bad cough. There are a number of different things out there on the internet that you can look at. But antihistamines, they're generally sort of separated into the drowsy and non-drowsy elements. Sorry, another cough there. I don't know what's going on here. They tend to be separated into drowsy and non-drowsy. So drowsy would be something like Piriton, chlorpheniramine, and non-drowsy would be things like Zyrtec and loratadine or Claritin, or those sorts of antihistamines. Very good. They need to be taken on a reasonably regular basis. Then you get like the nasal sprays, and they come in different types. You've got the steroid-based nasal sprays, which tend to reduce the inflammation and the secretions in the nose. Again, need to be used on a reasonably regular basis. The astringents, which tend to sort of constrict the blood vessels and reduce the secretions in the nose, thereby reducing all the mucus and the snot, effectively. And then you also got antihistamine nasal sprays as well, which work in a similar sort of way to the tablets. You've got eye drops. Again, they're designed to reduce the redness, which is what a treatment is. They cool the eyes down. Obviously, they get very, very red and sore. They can contain antihistamines, but they can also contain something called chromoglycates, which helps to reduce the immune response to pollen. But there's general sort of things in the armory of hay fever and antihistamines and nasal sprays that you can actually use, and they're not out there. Generally, what you would tend to do, tend to recommend the antihistamines first, and then maybe go on to these two later on. I mean, you can use these all at the same time if needed as well. There is a lot of debate about herbal or homeopathic remedies. I tend to be very much against those. But having said that, if the patient insists it works, it's not doing much harm giving it to them in the first place. There's you know, if it works for them, then fair enough. But it's not something that I would generally go out of my way to recommend. So hence this here, a very brief overview of hay fever. And so if you want to find out more about this, there are a few things on the website that you can download and look at your leisure. Now, we've got another 4 more bits to go. We're running really on time. Sun safety. This is a really important one. I've spent a little bit more time on this one. Let me just open up all these branches here. There we are. Now, sun safety is quite important, especially when it's you're going abroad, or if you've got a very hot summer, for example. Well, why is it important? Well, basically, you can get burnt, which is not very nice, but in the worst case scenario, you can actually, over a longer period of time, get things like skin cancers and really nasty little things like that, simply because you haven't taken the precautions to look after your skin. This is actually a huge money earner as well for pharmacies, and it's actually very important that patients generally apply sun protection factors and sun lotions, for example, on their body. Now, generally, the sort of things that you would tend to recommend are broad spectrum lotions and creams. By broad spectrum, what I mean is that there's 2 different sorts of ultraviolet light that could cause damage to the skin. You've got the UVA and you've got the UVB. Do you want to sort of reduce the penetration onto the skin with both of them? Now, UVA tends to be monitored by something called the star rating, and there's actually there's 5 stars, and you want to have a sun lotion of at least 4 to 5 stars. The UV is measured by the SPF, which is the sun protection factor, and you want ideally at least a factor 15, if not more than that. Really, what you want to do is you want to get one with both of these in it, and recommend something like that. So 4 stars, at least sun protection factor 15 as well. Other things you might want to also advise the patients as well. Obviously, apply it on before you go out into the sun. But also, these people will go swimming. They'll go swimming in the sea. They'll go swimming in the swimming pools. They come off. This comes off in contact with water. So what you need to do is reapply it on a regular basis. Straight after you come out, so dry yourself down, slap a hold on. Very important that you do that because you're not being protected. And the other thing is that there's a lot of misconception that simply because you're in the swimming pool, you feel cool, it's not hitting you, and it is hitting you. So again, if you're swimming, very important that you tell the patient to reapply. Another thing that you've got to bear in mind is a lot of patients will have these lotions from last year or the year before that. They do go off. Not a good idea to use something which is date expired. Okay. The problem is that no matter how much you tell patients, they will always come in burnt, always have some sort of issue with regards to this. Now, if that's the case, do come in burnt, then you can recommend a couple of things really. There's painkillers, paracetamol, ibuprofen, which will help with any pain that they're in. For the sunburn, it's more sort of like soothing type thing. So you can use things like Sudocrem. There's calamine lotion, which is another one, and you know, even cold water, for example, cold shower will help take the heat away from the skin as well. The important thing that you've got to bear in mind, and this is something as healthcare assistants as well that you've really got to be quite on the lookout for, is informing the patient, look, you know, if for example you've got moles and warts which are changing colour, or they're changing their consistency or their appearance, that's not a very good sign, and you would probably want to refer them straight down to the GP. The problem with UV light is that it can actually cause, in reasonably high doses, cancers on the skin. And that's one of the reasons why, for example, sunbeds are not recommended, because of the fact that they can actually encourage these sorts of things to happen. So bear in mind that this is really important, that, you know, unfortunately they're relatively painless as well, so you wouldn't really know that that's happening unless you were actively informed about the fact that that any changes to your moles really need to be looked at. So something that really you could do that's going to actually save somebody's life, and it's something that you really ought to have in the back of your mind. The final thing again is that, again, with sun safety, you'll get, you know, there's always a possibility of heat exhaustion. We covered that a little bit earlier as well. So again, if you notice the signs of heat exhaustion, which is, you know, things like nausea, vomiting, delirium, you know, you tend to get very sort of like very drowsy, possibly, maybe even fever to a certain extent, hot and cold, you know, that is something you probably would want to call the GP out on, or maybe refer them on to the hospital if needed. This one here is actually quite an important one, so I've spent a little bit longer than I have on the other ones, particularly for that reason. Now we've got three other things. Now, safer sex. Now, there's an old thing, in actual fact, that I quite like, that, you know, when somebody goes on holiday, comments tends to be at the airport. And things that you would normally never consider doing in your normal life, you would probably do on holiday. And this possibly one of the things that many people would do on holiday without realizing it. It's actually unsafe sex, in actual fact, I should say. There's actually a risk of two main. Well, I've broken it down into two things. I've called it pregnancy, unplanned pregnancy, and STI transmission, which is sexually transmitted infection transmission. Pardon me. Now, in terms of pregnancy, holidays tend to be one of the times whereby, as I said, you know, you're more likely than not to actually get pregnant, and the reason is that you tend to, well, not you, a lot of people tend to abandon the principles of common sense at times. So that's why what I want to recommend, if you're going on holiday, you know, it's a very sensitive subject to bring up, but if you get the opportunity, get them to take a load of condoms with them if they're intending to have sex. The problem is, if you're going abroad, especially a developing country, you don't know the standard to which those condoms are going to be used, or they're going to be bought in the country that they're going to. So, you know, EU kite standard type condoms, you really ought to take with, they ought to take with them, especially brought here because they're up to that sort of standard. Now, this one here is a little bit of, this can cause a little bit of controversy, but it's something that, again, your pharmacist should be able to explain to you. Now, you can get something called EHC, which is emergency hormonal contraception. You've probably all heard of that. Probably all heard of your pharmacist counselling patients on EHC. Again, what we've got to think about is whether or not it's appropriate in this circumstance, especially when the pharmacist is counselling the patient, to take something called advanced supply of emergency hormonal contraception. So, for example, if the condom breaks, or for example, they don't use a condom, they could be at risk of an unplanned pregnancy. They're in a country, for example, where EHC is not readily available, or it could even be banned for various reasons, religious reasons mainly. In which case, you know, is something like this a good idea to take with them? And in those circumstances, it probably would be if the patient requests it. bearing in mind the fact that it can be quite expensive, but it's something that perhaps it might be a good thing to take in case. The second thing you've got to bear in mind is sexually transmitted infections as well. The thing with sexually transmitted infections is that, again, you run the risk of, especially if you're going abroad for this person in mind, of getting these sorts of things. So, for example, the sorts of things you may contract, things like HIV, which is pretty disastrous, really. There's other things as well, gonorrhea, chlamydia. There's other sorts of syphilis. You know, there's a whole load of sexually transmitted infections. And one of the reasons why you ought to take condoms with you as well. So the sorts of things you've got to bear in mind. If somebody comes back from holiday and they're complaining of things like discharge, they're complaining of things like urination problems or problems with their genitals, if there's warts or anything like around there. Another thing you've got to bear in mind as well is the fact that a lot of HIV patients, especially within 2 to 6 weeks of contracting HIV, experience a lot of flu symptoms. That could be also signs of potential malaria as well. If they have come back with flu symptoms or you know, general hot and cold, you really ought to refer them back to the doctor to get assessed, especially if they've had unprotected sex abroad as well. So these things as well, I'm reinforcing this because this is sort of a DH message as well. Always recommend a supply of condoms bought from here if possible. Particularly consider an advanced supply of EHC, but your pharmacist should be able to advise the patient accordingly. Now, 2 more things. In actual fact, these aren't 2 big things we're going to be talking about. Bites. Now, again, in some, you're going to get things like insects crawling out. You're going to get bees, wasps. You're going to get creepy crawlies in the grass that are going to bite you. Fortunately for me personally, they tend not to like me very much. I've only got bitten once, and that was probably when I was about 5 years old. I don't know, I smell or something. I'm not sure why. But a lot of people tend to be more prone to bites than others. Now, if somebody comes to you for a bite, sorry, let me rephrase that. If somebody comes to you and shows a bite, not that you want you to bite them, but anyway. If somebody shows you a bite, there are a number of different things you can give. Okay, the first thing is hydrocortisone cream. The good thing about hydrocortisone cream is that it reduces the inflammation, it reduces the swelling, and some of the products, there are a few which contain crotonamiton. Now, there's a very good product called Urax HC, which contains both crotonamiton and hydrocortisone combined. Crotonamiton is a very good anti-itching agent, antipyretic, as the technical name is. So the two combined are actually very effective. This actually helps reduce the inflammation, while this one actually helps reduce the itching at the same time. Very good for bites generally. There are cautions relating to that, nothing too serious. You can read the back of the packaging and have a look for yourself, and there's rules, things like, for example, the age at which you can give this at, that you shouldn't use it for more than 7 days, and a few other things as well, but nothing too serious. But good ones, nevertheless, for you to look at. So if you get a chance to today, maybe have a look at Urax HC or hydrocortisone cream for bites. Good idea to recommend maybe some repellents to your patients as well. It's very good to prevent the insects from coming to your first place. Pardon me. It's very good also for malaria protection to a certain extent as well. In actual fact, I was at a travel lecture probably about a week ago. There's actually some evidence now to suggest that repellents are becoming less effective, especially the ones with DEET in it as well. But generally, as it goes at the moment, try recommending the ones with DEET. They tend to be the most effective ones at the moment. But bear in mind that for some reason that the effects of repellents tend to be reduced now. It's probably because the insects themselves are getting cleverer and realizing that they shouldn't be repelled by these things. Then with bites as well is that one of the things you feel is that they're very itchy, and you could end up scratching it. And if you do end up scratching it, you could end up introducing an infection in there as well. So before you recommend any of these, what you want to do is have a look at the bite to make sure that it's not infected, to make sure that it's not green or any other weird colour, that it's not too big, and there's nothing else major that's going on with it. So if you suspect an infection, it's probably the patient's probably going to be referred back to the GP to get some antibiotics to clear it up. But if it's just a small bite, then any one of these two here up here, Crotonotron or hydrocortisone, tend to be good ones. This one tends to be used for preventing the bite from happening in the first place. Right, so that's the majority of things. Now, I'm going to finish off now by talking about travel medicine now. In that fact, it's going to be a little bit of a cop-out, admittedly. One of the reasons why I decided to do Simon Medicine is we've actually got a special guest speaker this evening on travel medicine. It's for the pharmacists webinar. Now, you're more than welcome to come along to that if you want to. There's no reason why you can't come along to that. If you want to come along, I will give you our number so you can give us a ring and get the codes to access the webinar. This guy is actually very good. He runs travel clinics himself, and he's going to provide us with a really good webinar to get an idea of the sorts of things you need to watch out for. Two things that he's going to be talking about mainly are vaccinations. So, for example, what types of vaccinations are you likely to need in the country of your destination? So, for example, yellow fever, hepatitis B, and all these other sorts of weird and wonderful things that you're likely possibly to need. And he's also going to talk about malaria as well. But he's also going to talk about how to set up a travel clinic in your pharmacy as well. Believe it or not, Boots, I got an email from somebody yesterday, in actual fact it was. Boots are starting off travel clinics in their own pharmacy. And if they are seeing the opportunities there as well, perhaps it's something that you may want to consider. So if you are interested in this travel webinar, and I hope you all are, it's going to be at 8 o'clock this evening. And if you want to give us a ring, or give us a ring on 0208 8863 3335. And when you do that, what we'll do is we can give you a code and a link that you can link on to access that webinar. But as I said, you know, he's an expert in it. He's done it all himself. He's willing to share his experiences and with you as well. So that should be a good one for you to attend. I can see that I've spent about half an hour talking now, and we're running quite close to time. As you can see, I focused a lot on some unusual things that you're probably not likely to experience in many books, apart from things like hay fever and possibly sun safety. But I'm going to open up the airways now, so if you've got any questions, please feel free to ask. I'm going to unmute everybody now. If there's anything else? Anybody else? It doesn't look as if anybody is. Okay, if you're feeling shy and don't want to talk, then you can even text it to me. Does anyone do that?
No, I think that's quite good, Dipen. Thank you very much.
Okay, Minesh, thank you very much. Okay, so by the way, before you all go, it's going to be online, so you can watch it at your leisure. We're also going to be sending, the mind map itself is also going to be uploaded as well. So if you didn't manage to catch everything, you're more than welcome to download that mind map and use it at your own leisure as well. But again, if you want to attend that travel medicine webinar this evening, feel free to do so. We can give you the links to that, and just give us a shout. And so I will speak to you next month, and if there's anything else, feel free to contact me.
Cheers.
Bye.